Have you ever been kept awake by the sound of someone snoring? It's a common scenario that many of us have experienced at some point in our lives. The constant noise can be incredibly frustrating, especially when all you want is a peaceful night's sleep. You might find yourself tossing and turning, trying to block out the sound with pillows, or even contemplating moving to another room just to get some rest. Or maybe you're the snorer yourself. Snoring can be embarrassing and can affect your relationships with those you share a bed with. You might not even realize how loud you are until someone points it out. It can be a source of tension and discomfort, leading to sleepless nights for both you and your partner. Snoring is a common problem that affects millions of people. In fact, it's estimated that nearly half of all adults snore occasionally, and about a quarter are habitual snorers. This issue doesn't discriminate. It affects people of all ages and backgrounds. Whether it's due to nasal congestion, sleep apnea, or simply the way you're positioned while sleeping, snoring can be a persistent problem. It can disrupt sleep and leave you feeling tired during the day. The lack of quality sleep can have a significant impact on your daily life. You might find it hard to concentrate at work, feel irritable, or even experience mood swings. Over time, chronic sleep deprivation can lead to more serious health issues, such as high blood pressure, heart disease, and even stroke. But what if I told you there's a simple trick that can help? Imagine being able to sleep through the night without being disturbed by snoring. It sounds like a dream come true, doesn't it? Well, it might be easier than you think. Sometimes the solutions to our problems are simpler than we realize, and this is one of those cases. I recently spoke to a nurse who shared her secret for reducing snoring. Nurses often have a wealth of practical knowledge and experience when it comes to health and wellness. This particular nurse has seen countless patients struggling with snoring and has discovered a method that has helped many of them find relief. Her advice is based on years of observation and practice, making it a reliable and effective solution. It's so easy, you won't believe you haven't tried it before. The technique involves a few simple adjustments to your bedtime routine and sleeping environment. By making these small changes, you can significantly reduce or even eliminate snoring. It's a game changer for anyone who has been struggling with this issue. So if you're ready to enjoy silent, restful nights, stay tuned as we reveal the nurse's secret to silent sleep. Snoring happens when air can't move freely through your nose and throat while you sleep. This causes the tissues in your throat to vibrate, creating the sound we know as snoring. Several things can cause snoring, including sleeping on your back, having a stuffy nose, drinking alcohol before bed, and being overweight. The nurse's secret to reducing snoring is surprisingly simple. Keep your mouth closed while you sleep. It sounds almost too good to be true, right? But many people find that simply keeping their mouth closed significantly reduces their snoring. To understand why this works, I spoke to Dr. Mezher, a London-based GP. When you sleep with your mouth open, Dr. Mezher explains, your tongue relaxes and falls back in your throat. This narrows your airway, making it harder for air to pass through and increasing the likelihood of snoring. Section 5. Opening the airway with jaw thrust. Keeping your mouth closed helps to keep your tongue in place, preventing it from blocking your airway. This is similar to a technique used in first aid called the jaw thrust, where the jaw is moved forward to open the airway. By keeping your mouth closed, you're essentially performing a gentle jaw thrust throughout the night, ensuring that your airway stays open and you can breathe easily. Section 6. Mandibular Advancement Devices. Another solution. If you struggle to keep your mouth closed during sleep, there are other solutions available. One option is a Mandibular Advancement Device, or MAD. A MAD is a mouthpiece that fits over your teeth and gently pushes your lower jaw forward, similar to the jaw thrust technique. This helps to keep your airway open and reduce snoring. Section 7. The hidden dangers of sleep apnea. Sleep apnea is a condition that often goes unnoticed, yet it can have profound effects on your health and well-being. In this section, we will delve into the hidden dangers of this sleep disorder and why it's crucial to address it promptly. While snoring can be annoying, it's important to remember that it can also be a sign of a more serious condition called sleep apnea. Snoring is often dismissed as a mere inconvenience, but it can be a red flag for something much more concerning. When you snore, it means that the airflow through your throat is partially blocked, causing the tissues to vibrate. This can be a precursor to sleep apnea, where the airway becomes completely blocked, leading to pauses in breathing. Sleep apnea causes you to stop breathing for short periods during the night. These interruptions can last from a few seconds to a minute and can occur multiple times an hour. Each time you stop breathing, your brain briefly wakes you up to resume breathing, disrupting your sleep cycle. This can leave you feeling exhausted and unrested, even after a full night's sleep. The lack of oxygen can also put a strain on your cardiovascular system, leading to a host of other health issues. This disrupts your sleep and can lead to serious health problems like heart disease. When your breathing is interrupted, your blood oxygen levels drop, which can cause your heart to work harder to pump oxygenated blood throughout your body. Over time, this increased workload can lead to high blood pressure, heart arrhythmias, and even heart failure. It's essential to recognize the connection between sleep apnea and heart health to prevent these severe complications. Stroke and diabetes. The repeated drops in oxygen levels can also increase the risk of stroke by causing damage to the blood vessels in the brain. Additionally, sleep apnea is linked to insulin resistance, which can lead to type 2 diabetes. Managing sleep apnea can help mitigate these risks and improve overall health outcomes. If you snore loudly and regularly, or if you experience excessive daytime sleepiness, these could be signs of sleep apnea. Daytime fatigue is a common symptom because the constant interruptions in your sleep prevent you from reaching the deep restorative stages of sleep. This can affect your concentration, memory, and overall productivity, making it difficult to function effectively during the day. It's important to see your doctor to rule out sleep apnea. A proper diagnosis often involves a sleep study, where your breathing patterns, oxygen levels, and other vital signs are monitored overnight. Treatment options vary depending on the severity of the condition, but can include lifestyle changes, continuous positive airway pressure, CPAP therapy, or even surgery. Addressing sleep apnea not only improves your sleep quality, but also reduces the risk of developing serious health issues in the future. Don't ignore the signs. Consult with a healthcare professional to ensure you get the help you need. Section 8. Tips for a better night's sleep. Getting a good night's sleep is essential for maintaining your overall health and well-being. In this section, we'll explore some effective strategies to help you achieve better sleep quality and wake up feeling refreshed and rejuvenated. In addition to keeping your mouth closed or using a MAD, there are several other things you can do to improve your sleep. These devices can help reduce snoring and improve airflow, but they are just one piece of the puzzle. Limit screen time before bed. It's important to give your mind a chance to unwind and relax before you go to sleep. The blue light emitted from screens can interfere with your sleep. This type of light can suppress the production of melatonin, the hormone that regulates your sleep-wake cycle. To minimize this effect, try to avoid screens for at least an hour before bedtime. Avoid caffeine and alcohol before bed. Both of these substances can have a significant impact on your sleep quality. These substances can disrupt your sleep. Caffeine is a stimulant that can keep you awake, while alcohol can interfere with your sleep cycles, leading to fragmented and less restorative sleep. Create a relaxing bedtime routine. Establishing a consistent pre-sleep routine can signal to your body that it's time to wind down and prepare for rest. This could include taking a warm bath, reading a book, or engaging in other calming activities that help you relax, or listening to calming music. Gentle, soothing music can help slow your heart rate and breathing, making it easier to drift off to sleep. Make sure your bedroom is cool, dark, and quiet. The ideal sleep environment is one that is free from distractions and conducive to rest. This will help you fall asleep and stay asleep. A comfortable mattress and pillows, along with blackout curtains and a white noise machine, can make a big difference in your sleep quality. Keeping your bedroom at a cool temperature, around 67 degrees Fahrenheit, can promote better sleep. Your body temperature naturally drops as you prepare to sleep, and a cooler room can help facilitate this process. Darkness is crucial for good sleep. Consider using blackout curtains to block out any external light sources that might disrupt your sleep. If you live in a noisy environment, a white noise machine can help mask disruptive sounds and create a more peaceful sleep setting. Incorporate relaxation techniques such as deep breathing, meditation, or progressive muscle relaxation into your bedtime routine. These practices can help calm your mind and prepare your body for sleep. Journaling before bed can also be beneficial. Writing down your thoughts and worries can help clear your mind and reduce stress, making it easier to fall asleep. Consider drinking a cup of herbal tea, such as chamomile or lavender, which are known for their calming properties. Avoid caffeinated teas, as they can have the opposite effect. Establish a consistent sleep schedule by going to bed and waking up at the same time every day, even on weekends. This helps regulate your body's internal clock and can improve the quality of your sleep. Avoid heavy meals and large amounts of food right before bed. If you're hungry, opt for a light snack that won't disrupt your sleep. Regular physical activity can also promote better sleep. However, try to avoid vigorous exercise close to bedtime, as it can be stimulating and make it harder to fall asleep. Exposure to natural light during the day, especially in the morning, can help regulate your sleep-wake cycle. Spend time outside or near a window to get the benefits of natural light. Aromatherapy with essential oils like lavender can also be a part of your bedtime routine. The soothing scent can help you relax and prepare for sleep. Be mindful of napping during the day. While short naps can be refreshing, long or irregular napping can negatively affect your nighttime sleep. Finally, make your bedroom a sleep-friendly environment. Keep it tidy and free from distractions, and reserve it primarily for sleep and relaxation. By following these tips, you can create a sleep routine that supports better rest and overall well-being. Sweet dreams. Section 9. Take charge of your sleep tonight. Don't let snoring rob you of another night's sleep. Try the simple trick of keeping your mouth closed, or talk to your doctor about other solutions like a MAD. By taking steps to improve your sleep, you can wake up feeling refreshed and energized, ready to take on